Yeah, it's depressing, man. Like you said, there's a lot of suicides from these conditions.
Yeah, there
So
are.
how do you track those, right? If you're
That's yeah,
a 35-year-old man and you can't get an erection, you can't have sex, you can't have a relationship, and so then you're lonely, then you can't have a family, and obviously you're depressed, man. That's
yeah.
there's a lot of patients that just have a shitty life,
Hmm.
and I can't fix that you're poor and um you just lost your job and
Right,
you're abused by your husband or whatever, like, you know what I mean, and we
right.
just give you a pill to numb you, and maybe that helps you so you can go to therapy and whatever, maybe it helps you from crisis, but you know what I mean, like us, like a doctor, I'm just grateful a doctor will at least be open-minded and be like, yeah, it makes sense that they can cause problems.
Yeah,
Most just like get quiet and just said, well, this is all we can offer. And I've done, like I said, I've done so many different treatments, man. I could list like 2 pages of stuff.
yeah,
I'm at a point where I'm just where I'm at,
yeah,
and I keep trying here and there.
yeah,
Like,
yeah, yeah,
just I'd love to, if they did like a clinical trial or something, it would be interesting, but they have to recognize it.
yeah. That's step number one.
Yeah, and then like I said, if it becomes recognizable,
Mhm.
I don't think pharmaceutical companies are going to be keen on that, because I think that opens them up for lawsuits.
Honestly, man, I'm really curious about your story. I mean, so you have PSSD. You're a nurse practitioner. You might kind of give me a rundown on what your life was like before you developed PSSD?
Yeah, so I think I'm a good example because I'm speaking on both sides. I have my personal story, and
Right.
then I work in the industry. I'm even formerly trained in psychiatry.
Oh,
Um,
wow.
yeah, so I'm a family nurse practitioner, which is like
Hmm.
a general practitioner, right? For
Hmm.
6 years. I recently passed the boards. I'm just waiting for the license to get through, but passed
Okay.
my boards for psychiatry. So I'm also trained in medicine for this.
Hmm.
But yeah, I'm 36, so I was 27. I'm bipolar, and my first symptoms started around age 20. I was in the military, and it was really just really depression.
Yeah.
Um, so anyways, when I was 27, I became really depressed, right?
Hmm.
Where I got like, suicidal. I didn't, self-harm or anything, but I was
Sure.
desperate. People don't talk about, suicidal depression is the pain you feel.
Yeah.
So it's like this overwhelming dark cloud that it doesn't even matter if your life's going well. It's not about that. You just have like constant suicidal thoughts and you're in
Hmm.
emotional pain.
Hmm.
It's hard to handle. And it's like, it could be months, man,
Yeah.
longer for some people. I don't know. Everyone's different, but
Sure.
I went to a psychiatrist that's also a neurologist.
Hmm.
I paid her $400
Hmm.
because I wanted to see someone fast.
Sure.
Um, I talked to her for like, I don't know, 30 minutes, and I left with a branded SNRI.
Okay.
That's super expensive because she had samples.
Oh,
So
oh,
I'm like,
wow. Okay. Yeah.
okay.
Yeah.
And then she gave me Ativan, and
Okay.
then she gave me Ambien, all in the same visit.
Really?
So
Were these all sample packs or were these
no,
prescriptions?
Ambien and Ativan are generic. She gave me prescriptions. So, anyways, I was dating a pediatrician at the time, and
Hmm.
she goes, you should probably just ask for a generic med. I've never been on a psych med before.
Yeah.
I didn't take the Ambien. I don't like meds. I'm 27 and healthy.
Hmm.
I wasn't even diagnosed bipolar at the time.
Yeah.
So it was my first like psychiatric visit. So, anyways, I took like one day of the SNRI, and then I started sertraline because it's generic, right? It's
Okay.
considered the safest psych med in history, pretty much.
Yeah.
Sertraline, right? Zoloft.
Hmm.
So, she didn't tell me anything about side effects
Mm.
at all. No
Yeah.
warnings. I
Hmm.
took Ativan every once in a while, but not much because I don't want medicine.
Hmm.
Sertraline did improve my mood
Okay.
quickly. So because I'm bipolar, so I can switch. So I didn't get manic, but I went from suicidal to feeling really good.
Okay. Sure.
Yeah, so that was nice. I was like, oh wow, it's an antidepressant. I was a nurse, ER nurse at the time, and I was like, wow, this worked. Just
Yeah.
like
Yeah.
the title, right? It's that
Right.
simple.
Yeah.
She didn't tell me how they worked.
Hmm.
you know,
Mm.
she did diagnose me bipolar 2 at the time, but didn't tell me.
Hmm.
Um, And I took sertraline for a couple months, and then I was having sex and I could not ejaculate. I couldn't orgasm.
Okay.
I just absolutely lost the feeling. And before this, I had no issues with erectile dysfunction, sexual dysfunction at all.
Yeah.
I was fine. I was normal, a normal, healthy man. And I didn't even piece it together. It was the medicine, at first. Because again, I wasn't told this was the side effect. And who reads the side effect label? If you read the side effect, brochure, it's like 20 side effects,
Right. Yeah.
So, anyway, so then, it like wrecked a relationship because I couldn't like enjoy sex. Like I could have an erection, I could do sex, but then I was numb.
Yeah.
So what's the point of sex? Right.
Right.
It's like running half the race.
Yeah. I get that.
So, then I stopped sertraline, because then I realized, maybe it is the medicine. And it improved a little bit, but ever since that's been 9 years. I've never been the same.
Really?
Yeah.
Have your sexual issues improved at all?
I'm now. Well, see, I've been after that. So that's the beginning, right? So
sure.
I've been to probably 10 doctors. 10 different doctors, whether it's endocrinology, urology, primary care, psychiatry. Most doctors, because I'm formally trained, they don't dismiss me.
Okay, interesting.
Because I'll call them out.
Yeah. Good for you.
I'll be like, here's 5 PubMed articles. Europe recognizes PSSD since 2019, I think.
Sure.
Well, if they know you're a professional in the industry, they give you some grace, I think.
Mm-hmm.
Cause I'll just call them out and be like, actually, you're wrong.
Yeah.
Cause a lot of doctors, they get away with, PAs, NPs, same thing. They get away with, the patients not knowing a lot sometimes.
Mm-hmm.
So then they don't have to prove what they're saying.
You take it at face value when you're just a patient without.
Yeah. It's really, like I was saying before, we recorded, I think medicine in general is the worst form of science. We can't even agree on what's a good diet.
Mm-hmm. Yeah.
It's bad, right? If a civil engineer builds a bridge and it fails, they go,
kind of obvious.
Wow, we need to fix this.
Right.
So, in medicine, we have horrific outcomes. We're the sickest we've ever been. We keep our jobs. So it's embarrassing sometimes to be in medicine. But, so then after that, obviously, my bipolar worsened, which is a little atypical. It was really just periods of depression, man. So that's a little different for bipolar, not to have like a manic or hypomanic episode.
Sure.
Cause that's kind of the key feature of bipolar.
Okay.
And then I had more mania like later, like around 33, which is weird. I have some theories, but again, we're focusing on sexual dysfunction. So, I would try other medicines, and I think PSSD is a bad name.
Yeah.
So I think a better name would be like post-serotonin sexual dysfunction. I've been thinking about this because everyone's focused on SSRIs. Sure, that's a big group of medicines, but that's very limited, man. There's a lot of medicines that can cause PSSD symptoms.
I agree.
Yeah, and I could list them. You got tons of antidepressants, whether it's even atypicals. You have MAOIs, you have tricyclics, you have SNRIs, you have these newer medicines which are serotonin modulators. You have second generation antipsychotics. You have lithium, and I've probably been on at least 10 meds, probably.
Really?
Yeah, because I'm bipolar 1, so it got worse, and then obviously I got stable, and I've been stable for like 2.5 years.
So that's since you've taken the SNRI 9 years ago, you've been on approximately 10 different meds?
Yeah, so I was on SNRI for like 2 days, and then really was sertraline.
Okay,
so,
I got you.
Because the SNRI was she gave me samples, but the med was like $1,500 a month.
Yeah.
So that that's
expensive.
Yeah. So when I treat patients, I don't start with a $1,500 med. You know what I mean? I would start with generic.
Right. Yeah. Absolutely, man.
So I thought that was a little. It wasn't the best visit. And I've been to a lot of psychiatrists, man. And, I'm going to be working, I'm actually interviewing for psychiatry jobs now. I think there's a lack of like being open-minded,
Yeah.
and critical thinking.
Mm-hmm.
I've seen so many psychiatrists, they don't even ask you about your sexual health.
Really?
No, I haven't had one. The only reason they talk about it is because I bring it up.
Let me ask you this, man. When you've talked to doctors about this and they're initially skeptical, when you show them the articles, what's their reaction?
Well, it's been 9 years, right? So if you go back 9 years, it wasn't really recognized as much, right? I think Europe, like I said, 2019 is when they officially recognized it. We still don't have an ICD-10 code for it here in America. So that means I can't diagnose a patient, so we can't really track it.
Mm-hmm.
So if we can't track it, we can't even recognize it. How are we going to fix it?
That's where I wonder about the numbers. I mean, how common this actually is. I think it's more common than we know of, to be honest with you. Because
I could break down so many psychiatrists and their rationale. A lot of doctors hide behind studies.
Yes,
and
absolutely.
There's some people saying 50% of studies are can't be reproduced.
Okay,
so that means they're garbage.
Yeah.
So
yeah, that's crazy.
And it's like and then these psychiatrists, like if you deal with the SMI, right?
Yeah.
Serious mental illness,
mm-hmm.
right? There's a low bar for what's considered recovery.
Mm-hmm.
I go to an SMI clinic now and it's been fine, but the quality of psychiatric care is really just, hey, you weren't hospitalized.
Yeah.
And you're not hurting anybody or yourself. Like that's such a low bar.
Yeah, that is.
And then all these people are very sick, right?
Mm-hmm.
And, they can't have relationships, man. They have no idea. Like, what is their baseline's already so low?
What do they attribute it to? I mean, just further depression or OCD or,
SMI, a lot of it's schizophrenia.
Okay.
Right? Schizophrenia, bipolar, some really, treatment resistant depression. But I'm just saying, like, if you have this patient population that are zombies, basically.
Right.
I've been to the state hospital, man, did rotations there. Again, we don't even know, like, these statistics are off all the time.
Yeah.
We're not even tracking PSSD officially. Doctors don't even recognize it.
Mm-hmm.
Again, there's no ICD-10 code. So as a clinician, if I have a patient with it, because I'm going to ask my patients, like, how is your sexual health? Is it being affected by your medicine? I'm actually going to ask.
Yeah.
Because some patients won't even bring it up because they don't feel comfortable. But sexual health is so vital to your life, man.
It is, man. It's like your life force in some sense, when you lose your sexual health or your libido. I'm not sure if your libido's gone down or if you just have the sexual dysfunction.
Yeah. So it's not just like originally it was just like the ability to orgasm.
Yeah.
And then throughout the years, man, I've been on like 4 different PDE5 inhibitors.
Okay.
So Cialis,
yeah,
Viagra, all that helped for a while, but it's never been the same. And now I'm like the worst I've ever been. I don't care if I ever have sex again.
That's crazy.
I have no drive, man. It's so bizarre. Like, I'm married. My wife's beautiful. I can tell she's gorgeous. She's sexy, but I have absolutely no drive. It's crazy.
That's a weird thing, isn't it? My wife is gorgeous too, man. And, I can look at her and recognize that she's beautiful. But, there are times where I just don't have any attraction, sex drive, any libido to do anything. And that's it's embarrassing in itself,
Yeah.
I hate to put it that way. It is.
I got over, I think, the embarrassment. It is what it is. But that was many years. Yeah, it was really hard. It was hard to date. And I've waxed and waned, right? I've tried so many different interventions, man. I probably spent 10 grand out of pocket trying to fix this.
Yeah.
I went to naturopaths, tried NAD infusions, methylene blue.
Yeah.
I eat like basically a keto carnivore diet.
Mm-hmm.
I work out 3-4 times a week.
Take care of yourself. You do everything you're supposed to.
I do everything I can.
Yeah.
I go on, a medicine right now that's like one of the least causing sexual dysfunction symptoms. So I try, but it's horrific, man. And Most clinicians I talk to, they have no idea what this even exists.
My heart goes out to you, brother. It really does,
Yeah.
man. I know what this is like. I mean, I guess I'm curious. So, do you think there is a time and place for these medications, or do you think? I mean, what's your
Yeah.
thoughts on
So,
that?
obviously, there's a risk benefit, right,
Hmm.
analysis with any medicine, and
Sure,
that includes Tylenol. I've seen patients die of Tylenol overdose.
sure.
So, that's over the counter.
Hmm.
So,
Yeah, yeah,
I think as long as you have true informed consent,
yeah.
like when I give a antidepressant or antipsychotic, like, or mood stabilizer, etc., I'm going to tell them like, hey, sexual dysfunction is possible. And
Hmm.
then also it may never recover.
That's a big part right there. I think a lot of people would be deterred from taking the medication if they knew it could potentially be permanent, because
Yeah.
it's only a
Yeah.
one
And
percent
that's
chance.
okay. If they still want to take it,
Yeah,
that, I told them.
yeah.
Right. But we don't give informed consent with not just these medicines, but all kinds of medicines. We
I
don't
think
give.
it's pretty much all medicines, man. I mean, you made a good point earlier, which is that there's almost so many different avenues to getting something like this. It's not just SSRIs, SNRIs, all these atypical antipsychotics, finasteride, even some of the supplements we were talking about before, saw palmetto, lion's mane. I mean, it's almost like this is eventually going to fall under, like endocrine disruption syndrome, you know, because it affects so many different people in so many different ways. I mean, do you have any other side effects outside of the sexual, or is it primarily just those? I mean, you mentioned
Yeah.
depression.
I can't feel happy.
Yeah,
I haven't felt happy in 3 years.
really.
Yeah, I just can't feel it. The
Yeah.
only emotion I feel, not necessarily an emotion, but I can feel stress. I can get some anxiety. I can be like calm, but I
Yeah.
don't feel joy, happy. I don't really feel sad. Like I get a little sad, but not like, I don't have the normal human range of emotion.
Yeah, I was gonna say. Yeah, I get that.
Yeah, so that's tough. I would be happy if I could just get some sexual functioning back.
Right.
You
Absolutely. Yeah,
know,
yeah. No, I get that, man. I do. I
um,
understand that.
I don't give up. I've tried, I don't know, so many supplements. I've been at, like I said, at least 10 different doctors.
Hmm.
I've had MRIs in my brain. I did coffee enemas. I've
Hmm.
done so many different things. I've tried medicine, right? In
Yeah, yeah,
psychiatry, we're taught to try Wellbutrin,
yeah.
bupropion, because it's dopamine, norepinephrine. It's a unique, one of a kind medicine.
Hmm.
Um, that didn't help. I tried that
Hmm.
like 2 or 3 times. I tried Buspar, Buspirone.
Okay.
Uh, I've read about vortioxetine, which may make it worse, may help. I mean, there's just no good evidence, man, because again, we're not even recognizing it.
Yeah, yeah.
And then the pharmaceutical company has no benefit because if they admit that they cause permanent sexual dysfunction, they're open to
Yeah.
lawsuits.
I've
So
said the
why?
same thing, man. They're not incentivized to research this or to try to understand it. I mean, it's kind of left up to us to, find people who are willing to take this on and do research and, fund the studies ourselves. I mean, that's a really difficult position to be in. It's not fair. It's ridiculous.
Yeah, and it's so dark, man. Medicine is so dark. I think that a class action lawsuit would help if enough
Yeah.
people got together and we found a group of lawyers that would go after. And I'm not even after the money. I'm after you to recognize it
Right.
and you to then start to treat it.
Yeah. Treatment. Absolutely. Yeah.
But it's really depressing, man. Like I said, it's hard to even remember when sex used to not be a stressor and when
Hmm.
sex used to be just enjoyable and natural.
Yeah.
Now
Yeah.
it's like it's a task.
Yeah, I get that entirely. I mean, for me, it's become more of a chore at this point, which it never was before I got post-finasteride syndrome. It's supposed to be an enjoyable experience, and that gets robbed from you. And like we said, I mean, it's sort of like your lifeblood in some sense. I mean, when I lost my libido, I mean, I kind of lost the motivation for almost anything else in life. I'm sure it's all connected to your emotions, your sex drive. It's all kind of intermingled together, and when you lose that, you kind of lose your drive for everything else in some sense, at least in my experience.
Yeah, the human body experience. It's yeah, I don't have the same drive I used to have. I
Yeah.
don't have the same energy either.
Yeah.
Um, yeah, I can't blame the medicine for everything. And I've been on
Sure.
multiple medicines. I can just tell you, with the story, I know definitely sertraline is what started it.
Yeah.
and that's classic PSSD because that was before I did all these bipolar medicines and stuff.
Yeah.
But yeah, it just got worse and worse and worse and worse. And man, I try to enjoy different aspects of life, like when it's quiet and I could read.
Yeah.
I hope that there's some form of treatment eventually.
Yeah.
A lot of the treatments for sexual dysfunction are targeting like mainly just erections in men.
Yeah.
Right.
Right.
So, you have like injections and stuff. Like I can get an erection, but then it doesn't like last, and then I
Right.
don't enjoy sex. There's not
Yeah.
a treatment for that.
Yeah.
They're looking at like oxytocin. That's
Okay.
kind of interesting.
Yeah.
I did try that too. I tried that and it didn't help. It's like a new med that they use for females for when they have low, I think it's during menopause, their sexual libido goes down. And don't even get me started on women, right? Women don't get erections.
Right.
So we can't physically see like, oh, you're aroused, right? Obviously there's lubrication, that kind of thing. But
Sure.
there's so many women that are used to not having orgasms, not having libido. So I think women are really underdiagnosed for PSSD.
I would believe that. Yeah, entirely.
And we do not understand female sexual health at all. Like it's there's so much more than just, I mean, they do like PRP injections, and now they're doing like oxytocin and some new meds for women, but we do not understand female sexual health.
That's crazy to me. Why is that, you think? I mean,
well, we don't understand, like we don't really understand arousal. We don't really understand.
Yeah, I've heard that.
Like we have some, hormonal theories, I think, some basic knowledge.
Yeah.
But, and then going back to psych meds, we don't even fully understand the psych meds. So if you look up the medicine, look at the mechanism of action, it will state the full of the, what does it say? It says like the full understanding is not understood. Something like that.
Yeah. I interviewed, Joanna Moncrief by chance?
Yeah, she's wonderful. I follow her.
Yeah, she's awesome, man. I interviewed her probably about 2 months ago, and she was talking about that, how, the chemical imbalance theory is sort of a myth. We don't really understand what the mechanism of action is with these drugs. We know that they seem to work for some people. You take them, you feel better. And for a lot of people, I've seen that they take the medication just fine for years, and then when they come off, they deal with the withdrawal effects or, PSSD, because that's almost separate from withdrawal. And, they can develop these permanent side effects, and they're not aware of that until they actually come off the drugs. That's the crazy part.
Yeah, we're not trained very well on tapering. There's not good guidelines on it.
Right.
When I tapered off sertraline, I did it myself.
Yeah.
And I tapered, again, 9 years ago because again, I was having the sexual dysfunction. Sertraline was the hardest med to come off of.
Okay.
And I've come off antipsychotics, mood stabilizers, stimulants. I've done every other class. Sertraline was horrible. I had like 3 weeks of like brain zaps.
I've gotten those. Yeah.
Yeah. And it like shocks you in the head. It's like a lightning bolt hits you in the head. I'd just be randomly at work and like, oh my God. I would get pre-syncope, so I'd almost like pass out. Nauseous, fatigue, like flu-like symptoms. That was withdrawal. That had nothing to do with depression coming back.
Right.
A lot of doctors are not open to talking about this.
Yeah.
Or they deny the prevalence.
Yeah.
Which is really messed up because it's like, well, we don't have good tracking for it. So you really don't know what you're talking about.
I guess I want to dig a little bit deeper into that. I mean, why are doctors so resistant to listening to patients, in your opinion?
Well, if you have to admit that you're part of the problem, that's hard, right?
Yeah.
If you have to admit that, I've been in medicine 10 years, man. And like I said, I recently applied to an engineering program just because I'm so sick of medicine.
Yeah.
Yeah. If you're able to ask questions, be open-minded, it's a rough field to be in.
That's, you're probably familiar with Dr. Joseph Wood-During as well. Have you heard
Yeah,
of
I
him?
would love to meet him. He's wonderful.
Yeah, it was an honor to have him on the channel. I interviewed him probably about a month and a half ago too. And he was talking about that you can't ask questions in the medical field. They just provide these studies and you go by what the studies say. And if you challenge them, well, then you're kind of looked down upon, and there's sort of this idea that you want to, I'm kind of paraphrasing here. You almost want to fit in with your peers. So you don't want to be the odd man out, challenging the narrative or challenging the studies. And so a lot of people just have this natural inclination to kind of just go along with the movement without asking those questions. I mean, that's a really concerning thing when you have medical professionals who are supposed to be there to help you, who don't want to listen to their patients. I mean, it's just so pervasive, man. It's really unbelievable to me.
Yeah, I had a psychiatrist. He was 83 years old. He was a bipolar specialist, and he did diagnose me accurately before it got worse. It was really interesting. But he told me I care about sex too much.
Really? It's kind of a
Yeah,
bold thing to say. He doesn't have sexual dysfunction, I would imagine.
probably not. And
Yeah.
I was like, Doc, I can't feel anything.
Yeah.
I'm like,
Yeah.
he's like, you care about sex too much. And I'm like, that's your personal bias and an absolute horrible thing to
Yeah,
say.
you shouldn't be inserting that. That's not really the point here.
Yeah,
You know?
I've had, my psychiatrist now, she's okay. She recently told me, you've tried every medicine. And I go, no, I haven't. I actually know the medicine, so that's not true.
Yeah.
Like, they're even, like, again, most patients they have won't question them.
Mm-hmm.
I'm glad I see patients now using AI, using Google, and I'm happy they do. I'm like, please help me. Right. I want you to be an active participant in your care.
Right.
Absolutely. It's wild, man. In psychiatry, I haven't had one doctor talk to me about diet, exercise, stress reduction.
Unreal.
Just that, like 90% of depression can be related to life events or
I agree.
stressors.
Right.
Makes sense.
Right.
Psychiatrists are trained a lot, man. They have a lot of hours, and most of them don't offer any sort of psychotherapy, which also is
Unreal.
lazy.
Yeah.
So,
I mean, I've gone to therapists in my life before, and dude, for me, I think it's the best thing in the world. I think everybody should go to therapy at some point. I would unload for 60 minutes, tell somebody all my problems, and I'd walk out of there with my head held high because it was like a release in some sense. That helped any type of depression episodes I ever went through in my life. But you go to a psychiatrist, and the first thing they tell you, or even just a general practitioner, well, here's Prozac, here's Lexapro. They just put you on a medication, and they kind of play into the narrative that this is just a chemical imbalance without actually assessing your life circumstances. Like you said, your diet, your sleep, your exercise routine, what you have going on. Maybe you're going through a divorce. Maybe you're having a difficult time at work. I mean, those are all things that can be addressed homeopathically without, needing to be put on medication.
Yeah, I think, again, I'm not anti-medicine 100%.
Sure, no, I get it. Yeah.
I have medicine that can help, stops me from going up.
Yeah.
Right. I don't think we have great medicine for depression.
Yeah.
Right. If your wife leaves you after 20 years and you're not depressed, I think there's something wrong with you. Are you a sociopath?
I would agree. I would agree. Yeah.
If you're sexual dysfunction, if you can't get an erection, of course you're depressed.
Right.
Like, I'm so sick of the PSSD recommendations. Maybe you should go to CBT therapy. Yeah. I know CBT. I'm trained in CBT. I can't tell myself, I can't have sex. Like, how am I supposed to be happy, man?
Right.
Like,
yeah.
It's a joke.
Thinking patterns for that necessarily,
There's nothing, man. And in therapy, I think a lot of it is like having a friend and venting.
Yeah.
Traditional therapy is really supposed to have goals,
right?
Objectives, a timeline,
right?
Right. I went to therapy for 10 years. I did all kinds of trauma therapy and all this stuff.
Yeah.
And I got to the point where it's enough.
Yeah.
A lot of it is really just, it feels good to vent and let it out.
Yeah.
Obviously I'm a big fan of therapy, versus medication. But if you're gonna self-harm, man, if you're gonna hurt someone else, if medicine has to be part of the equation, right? Sure. At least a thought.
Yeah.
Right. If you're actively psychotic, man, you're delusional, paranoid, inpatient hospital, right? Then medicine has to be part of the situation. But we also get lazy in psychiatry where there's a difference from acute management and maintenance.
Right.
Right. These meds were never intended to really be on forever. The studies on SSRIs are really 8 to 12 weeks. That's it. We don't have 10-year studies that these people are on for 10 years.
Yeah.
Also, the body tries to have homeostasis. So when you adjust neurotransmitters like serotonin, norepinephrine, dopamine, etc., over time, a lot of them, if not all of them, do lose efficacy.
Yeah.
Then you have to start switching them.
Right.
And no doctor's telling you, hey, this probably won't work your entire life.
I think it's tough. I mean, the body is such an intricate system. And, like we talked about, we don't necessarily have a biomarker or a mechanism of action for these drugs. And
Not a true, like, full understanding.
Right. And so when you disrupt these symptoms, we don't necessarily know how to get them back into a state of homeostasis per se. It's all kind of just experimental, I guess, in some sense.
Yeah, I've done injections, man. Bimix, trimix. It does nothing. It only hurts.
Yeah.
The Cialis, Viagra, relatively safe medicines, worth a shot in men.
Sure.
Women get so undiagnosed, and I don't use terms like misogyny. I just think it's lack of understanding, and we just don't understand women's sexual health.
Right.
We don't. Men, again, we have an erection, so we can see that. We can see.
It's easy to, it's easy to sort of diagnose.
We have vacuum pumps. We have, there's this new device called the Mcella. Have you heard of that?
I haven't, no.
Yeah, it's just kind of interesting. Urologists doing it. It helps with pelvic floor dysfunction.
Yeah.
You sit on it for like 20, 30 minutes and it causes, I forget, thousands of vibrations. So it's like an intense workout for your pelvic floor. So that's interesting.
Yeah, for sure.
But yeah, we don't understand. And we need to like broadly consider, how do we reset the brain prior to any of these psychiatric medicines or finasteride?
Right.
Accutane, right? Accutane, I don't think it's used as commonly as it was. I was on Accutane actually as a kid twice.
Really? Yeah.
Yeah. Again, no side effects described except for liver failure and harming a baby if you're pregnant.
I honestly wonder if, because you were on Accutane twice when you were a kid, I wonder if you almost, how do I put this? Predispose yourself to having a side effect from these drugs the more you take them. I've talked to people who took Accutane once or twice when they were teenagers, didn't have any issues. They went on finasteride in their late 20s, early 30s, and then they get hit with full-blown PFS. I mean, the physical changes, the sexual dysfunction, the neurological issues. It almost makes me wonder if they had just started with finasteride without ever having a previous history of taking Accutane, would they have had the same detrimental outcome that they have now?
Yeah, I don't know. Accutane is definitely used loosely.
Sure.
It is very effective.
Yeah.
But I think it's probably, again, like most medicines, it's overprescribed.
Yeah, absolutely. Yeah, I guess I'm curious about that too. I mean, why do you think these medications are prescribed? They're so commonplace in society. I mean, like I said, you go to a general practitioner and you say you have depression. The first thing they want to do is give you an SSRI or some type of antipsychotic.
So I'll try to support clinicians. So
Sure.
One thing is, some psychiatric clinics, they're pumping out money, man. So the psychiatrists or NPs or PAs are under stress where they're seeing 4 patients an hour.
Yeah.
Another thing is, no one discusses is a lot of patients want a quick fix.
Right.
So they don't want to lose weight. They don't want to go to therapy. They don't want to meditate. They don't want to hear that. Like, I mean, I'll literally offer stuff to patients. And they want an antibiotic. Right. Like, how can I change like what they want? Yeah. So that's a problem too. No one discusses. Not to, again, I'm trying to be balanced as in, I get it. Yeah. All medicine is evil.
Right. I get that entirely, man. I try to say the same thing because I mention this all the time in the podcast. I never want to try to demonize medicine as a whole, but we got to have the recognition of these iatrogenic diseases, right? And we need to have a true informed consent for people. And I think honestly, like you said, there's a big profit in all this. I don't think doctors are inherently evil by any means. But if people, again, knew the idea that there could be permanent side effects from these drugs, I don't think very many people would take them, especially you have somebody who has high libido, right? Whose sexual functioning, whose sexual life is such an important aspect of their existence. If they knew they could all of a sudden lose that sexual functioning, I just, I don't think people would even consider taking these drugs. There are some, don't get me wrong. I think the number of people that do take the drugs would go down significantly though,
Yeah. And another thing is, as long as you have informed consent, man, and you tell them, hey, this is what can happen. You can have hyponatremia with SSRIs. That's never talked about, especially in the elderly. Yeah. Right. Low sodium levels. So they should be checking labs. A lot of psychiatric clinicians don't even check labs. Mm-hmm. Like,
Yeah.
You know, it's just pill, 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 pill.
Absolutely.
But you know, another thing too is I haven't met one doctor in 10 years that said they hope their kids are a doctor.
Really?
Yeah, it's really sad.
Hmm.
You know, physicians have a high suicide rate. I don't know if it's 2 to 3 times the general.
Interesting. Okay. I didn't realize that.
Yeah, so people don't understand the stress they're under. They also have $450,000 in debt now.
Yeah. Yeah.
They can't be a primary care because they make like 200 roughly.
Yeah.
That makes no sense with ROI, return on investment, right?
Yeah, for sure.
So that's a problem. You have to go into specialties, and the only thing that really pays is procedures,
Okay.
right? So CMS really reimburses fairly well for procedures, but we're not treating doctors well, right? They're under so much stress, man. Then they're 32 finally making money, and they have, you know, missed out on a decade of investing, saving, and they have a house payment for their student loans with high interest.
Yeah.
So they have to work these 60 hours a week, man, to catch up and make a good life.
Yeah.
So I'm trying to be balanced in some of these views. NPs, PAs, you'll see more like at least 100 grand in loans.
Really?
Yeah. So you'll see a lot of that. I served in the military and paid cash for both my master's degrees.
Yeah.
But I'm pretty rare as a clinician.
Yeah, for sure. I think that's an interesting point. I mean, there's so many different foundational issues that kind of play into this, you know. I think it's interesting that you haven't heard of too many doctors saying they want their kids to be doctors. Like, they recognize just how, I guess, abrasive the field is and how stressful it is. It sounds like a lot of them are just trying to get by the best they can, you know.
Yeah, I would say most doctors are good people, man.
Sure, I would believe that.
Yeah. You know, I think they're trying their best.
Yeah.
There are some bad ones. There's bad cops. There's bad firefighters. There's bad teachers. But I think most people are good people.
Yeah.
You know, obviously the bad ones stick out, right?
Yeah.
But yeah, it's rough, man. You're having NPs, PAs replacing doctors. I'm a nurse practitioner. Our education is nothing compared to being a doctor.
Yeah.
PAs, physician assistants, they have education, and it's like 27 months.
Yeah.
And they're, you know, we're supposed to, you know, do the whole job they do. And it's like, how can I, with 1,000 clinical hours, when you have 3 years of residency, maybe up to 7 years, like, how am I supposed to compare to you?
Right.
You know, we're supposed to support you, not replace you.
Right.
You know, it's just impossible. It makes no sense, man. Like, because there's this like fight between doctors, MPs, PAs, and it's like silly. It's like, I was in the military, man. Shut up and color. Like, understand your role.
100%. Yeah.
Yeah. Because again, you know, if you need, I have a buddy that's an ER doc, right? He makes a lot of money. He's a great guy. He's a stud. He deserves every penny he makes, man, because of what he does.
Sure. Absolutely.
Right? And there's some psychiatrists, man, that are amazing, compassionate. They do provide some therapy. By the time you get to a psychiatrist, though, right, you've already seen your PCP 2 or 3 times and been on 2 or 3 meds from the PCP. Right. The primary care is actually the main prescriber of these antidepressants.
Is that so?
Yeah. People don't know that. So, again, I come from family practice background, right? So we're taught even less than what psychiatry is.
Yeah.
So you have primary care is the first one to throw you on a Zoloft, Celexa, etc.
What's your opinion on that? I mean, do you think that's right, or should maybe the psychiatrist who specializes in that field be the only ones who should be prescribing them?
I think psychiatry, they know so much more about these meds.
Yeah.
They have way more experience with them and more difficult to treat conditions.
Right.
They can really, you know, primary care is not taught that much about psychiatry. So basic stuff, man, just to get by. But again, you don't want psychiatrists to be so overloaded where there's a 3-month wait.
Yeah.
So there's a balance with it. We need to stop living by labels.
Yeah.
That's a problem. So, you know, a doctor will say you're treatment resistant depression. That just means you failed 2 meds.
Yeah. That's
tons of people.
Yeah.
But it makes you feel like I'm treatment resistant and I can't be treated. Or I have severe depression because this PHQ-9 says it.
Yeah.
Like what happened to like, maybe it's not, what's severe, what's mild, what's moderate.
Yeah, it doesn't seem like we have good criteria for determining that. And you mentioned too, I mean, I think you said 90% of depression can be treated with lifestyle changes if people are willing to take on that on, you know?
Yeah, lifestyle changes, but the ketogenic diet, metabolic psychiatry is really exciting. Dr. Georgia E, Dr. Chris Palmer, they're kind of leading the way.
Mhm.
It's pretty amazing what they're seeing. And even like SMI, right?
Yeah.
Schizophrenia, bipolar, much harder to treat conditions
Yeah.
and worse outcomes.
Right.
Right. Obviously there's the extreme depression fits in there, but mainly bipolar schizophrenia. They're the more serious conditions.
Yeah. Yeah.
So you're seeing changes. You're seeing ketamine. At least it doesn't have known sexual side effects. TMS, at least it doesn't have known sexual side effects that I've seen.
Right.
So at least we're having some interventions that aren't causing this. So that's some hope.
It seems like the psychedelic route is kind of becoming a big and upcoming thing for treating mental health issues. What are your thoughts on that?
I'm a huge fan. Obviously we need to have some grace with it.
Yeah.
I never think there's a miracle. I don't like using terms like that,
Right.
but we need to look at other things. Psilocybin can help with like just end of life anxiety about death.
Yeah.
People can accept that they're dying. Like that's wonderful, man. I've had hospice experience, and the saddest thing is they're scared to death and lonely.
Yeah.
Right. So the problem is these psychedelics are Schedule 1.
Okay.
Which doesn't even fit the criteria.
Okay.
So at least make the psychedelics Schedule 2, like Percocet.
Okay.
Right? That makes sense. That kills a lot more people than psychedelics. So make it Schedule 2. It really should be probably like Schedule 5, right?
Okay.
If it was my opinion.
Okay.
But 1 through 5, right? Schedule, the DEA controls this. So Schedule 1 means they're really hard to research.
Yeah.
Like when I was in the hospital as a ER nurse, it was harder to get THC for a cancer patient than it was to get fentanyl.
Really?
That doesn't make sense because
that's
marijuana
crazy
is
to me.
Schedule 1.
Right.
And that's been that way since I think the 60s, I think.
Yeah, ODing on fentanyl is a pretty easy one, People die from that.
All the time. I've
Yeah.
seen so many overdose deaths.
Yeah.
I've seen so much death in the ER and ICU.
Okay.
At least make the psychedelic Schedule 2, right? So then it's easier to research. We admit that there is actually a medicinal reason for it.
Right.
Like opiates shouldn't go away. If you broke your femur, man, morphine can really help you.
Sure.
Right? But you don't need to be, the pill mills that we had out of Florida, right?
Right.
The whole country, but that we had 10 years ago.
Absolutely,
So
man.
there's got to be a balance, man. And a lot of these discussions have no nuance. And I try to balance being, I'm a harmed patient.
Right.
Right. And I'm also a clinician.
Right.
So I try to balance this. I'm I'm on both sides. So I try to be in the middle.
Right.
I'm upset and angry.
Of course.
Like I really am because my life's destroyed.
Yeah.
But I try not to have these absolute statements.
Yeah.
In America, we follow a pendulum, right?
Yeah.
We're over here and then we go over here and we go back. We never stop right in the middle.
Right.
And now if even you're a centrist in discussions, you're attacked.
Yeah. Yeah, you are. It doesn't matter. It doesn't matter what position you take. You're going to be attacked no matter what, ultimately, Yeah, even with finasteride, I'm more than happy to acknowledge the fact that people take finasteride without having any serious issues, any permanent side effects. It helps them. It helps their quality of life. They grow their hair back. They feel better about themselves, more confidence. Cool, man. I'm personally not trying to take that away from people. Same thing with people who take SSRIs, right? I mean, people can take them. They have good experiences with them. They come off the medication. Some people don't even deal with withdrawal, from my understanding. I don't know if that's a kind of a blanket statement, but I try to have that nuanced balance between the two. Because again, I'm not trying to agitate either side. I just want people to know the honest truth of what can happen if you do take these drugs. And for some people, I mean, the fact is it's life ruining. It can absolutely destroy the lives of people, which can lead to suicides and just really detrimental, life-altering side effects. I mean, we were even talking about the psilocybin, for example. I've seen that that's becoming pretty big in the veteran community in particular. I've talked to a few veterans who have done psilocybin after, having treatment-resistant depression for years because of PTSD, and they take psilocybin or what's another one? DMT, I think, is another one. I don't know if that's considered a psychedelic. Is that a psychedelic? That's another one I've talked to guys about, though, and they've seen tremendous results. They feel better after doing just, one dose of it, one experience, right? And all of a sudden their life completely changes. It's not necessarily like that for everybody, but I think we do need to explore some of these alternative therapies.
I think you're starting to see change.
Yeah.
Unfortunately, in medicine, it takes time.
Yeah.
They used to say, it's probably not that accurate now, but they used to say when something new comes out in medicine, it takes 20 years for it to be widespread use.
Oh,
so you want to talk about
a long time.
How ridiculous this is.
Yeah. That's insane, dude. Why do you think it takes so long? I mean, especially when you have thousands of patients going to their doctors and talking about these really serious side effects. I mean, why isn't this being acknowledged now?
I'm just saying, like, by the time the guidelines get changed,
I gotcha.
By the time the DSM-5 and the DSM-6 comes out,
yeah,
and it's really hard to objectify mental health.
Yeah,
how do you objectify the human experience? The DSM-5 tries to, right? It tries to separate disorders, and the diagnosis, I think, gives you a track to follow.
Yeah,
right. But I try to tell patients, like, the diagnosis isn't everything. Right? You don't need to live by this diagnosis.
Right.
There's exciting stuff, though. I try to be, like I said, hopeful. Stem cells are interesting, exosomes.
Yeah.
America is always behind because the FDA, I live in Arizona, man. You go to Mexico, it's a Wild West. You can try all kinds of stuff.
I believe
they have ibogaine clinics, psilocybin, stem cells. They've had this for years, and they legit doctors.
Mm-hmm.
So I don't blame veterans for going down there. I go to the VA, and everything's been pretty great other than the mental health. It's absolutely horrible.
Yeah.
It's really pathetic. No wonder why, it's the worst mental health I've ever had is the VA.
Yeah. I've heard that from plenty of veterans. There was an article just published recently in the Wall Street Journal. I think it was last week, about the overprescription of antipsychotics to veterans. And there's one guy, I mean, I think he was the kind of the focal point of the article. He was talking about how he was polydrugged. I think he took like 10 different drugs. They just prescribed him. And he said he didn't feel anything. He didn't feel any better. He felt numb. He felt more suicidal. It didn't help him at all. But that's what the VA seems to do. Somebody comes in with PTSD. There's no cognitive behavioral therapy. It's just, hey, take these drugs and move on,
It's scary. We're using like a lot of antipsychotics like Seroquel off label.
Yeah.
We're using, don't even get me started on children that are on meds.
Yeah.
I mean, they're 12, they're 5 years old and they're on meds. Obviously there's instances where they're self-harming or something, but it's rough, man. We have no idea what this does for neurodevelopment of kids. We have
That's
no idea.
Unbelievable, man.
So who knows what they turn out to be in the future.
Yeah, absolutely. Well, Francis, real quick, just going back to your story a little bit. So, I mean, you were pretty active before you were put on any type of psych drugs. I mean, you were in the military, you said.
Mm-hmm.
Just out of curiosity, what branch were you in?
I was in the Air Force. I did 8 years.
Cool,
I was
that's
an
awesome.
AC guy.
Didn't want to do your 20? Didn't want to do your 20 years?
No, I got disqualified because I was bipolar. So.
Oh man, I'm sorry to hear that, man.
Yeah, which sucks. Even if you're stable, they don't care. So
yeah,
I would have been an officer. I'm a nurse practitioner with 6 years experience. I'd probably be an 03 or captain, easy. But that destroyed my dream. I mean, yeah.
I'm sorry to hear that, man. I really am.
Yeah, thank you.
But you were really active in your life, though, obviously, before you took these medications. So, I mean, where you're at now, I mean, I think you mentioned you read a lot now. Is that right?
I read a lot.
Yeah.
I try to get financially independent.
Yeah.
We got my wife and I have like less than a 5-year plan, and we'll be like semi-retired.
Good for you guys, man. That's awesome.
So if medicine keeps getting worse and worse, I'll probably just leave it.
Yeah.
And you're going to see a mass exodus of clinicians.
You think so?
Talking about that. Yeah, it's not worth it anymore. The return on investment's not there.
Kind of a scary thing, to be honest with you. I mean, people are discouraged to go into medicine at this point, and that's obviously a very necessary field.
Patients are really upset. Understandably, we did a really poor job during COVID as a profession.
Yeah.
At least, hopefully, people can agree on that. It was horrific.
Yeah.
Public health outcomes are absolutely horrible.
Yeah.
We could debate that, but that's another time.
Yeah.
And then patients mistreat us, right? There's been patients that shoot doctors, that abuse us, that hit us. I've been spit at, hit.
Yeah.
and there's no repercussions for patients. And it's like,
Yeah, that's tough, man. And honestly, Francis, I think it's why it's good for somebody like you to speak out, to kind of highlight, I guess, the balance that's sort of needed, right? Going back to not wanting to demonize all doctors. I mean, they're individuals, you know, they have their own lives. The vast majority, I think, are trying to do their best, obviously, and they're subjected to these really intense working conditions. You know, they're kind of underpaid in some sense. You know, like you said, you're 32 years old, you got $200,000 in debt, or I think you said $400,000, and you're on a $200,000 a year salary. I mean, it's hard to pay that back.
you never do, man. And then you actually pay like 800,000, 900,000 by the time you do the 30 years or whatever those loans are.
Yeah.
That's bananas. That makes no sense.
That is insane, man. So a lot of doctors, I guess, are in debt then, essentially.
A ton of them. Yeah. It's obviously the specialties are doing okay still. Mm-hmm. CMS has cut doctors' reimbursements for 30 years straight, I think. Mm-hmm. And then every once in a while, Congress, which is a mess, they every once in a while they keep cutting doctors' reimbursements. Yeah, it didn't since the 90s, man. And really? There's been no adjustment for inflation.
Yeah.
Independent doctors, which I think are the best. The best doctors are independent because they're not, you know, they can more practice medicine, right?
Yeah.
The hospital MBAs aren't telling them how to practice. Right? When they're independent, they can do more what, you know, they're a business owner and they're amazing. They don't get reimbursed as well as the hospitals do.
I got
That's
you.
the problem.
Yeah.
I'm telling you, you're going to see less people go into medicine. You're going to see the good ones leave.
Unfortunate, man.
Yeah, I might go into engineering or something. I don't like medicine because, like I said, the science isn't great. We can't agree on anything. It's
a very disturbing insight. I appreciate it. I really do. But I guess it's the truth. You know, it's from your experience, what you've seen. So, no, Francis, I really appreciate all the information, man. A few more questions here regarding your PSSD. How have your friends and family reacted? I mean, do they believe you? Do they validate you?
They have no idea. They have nothing to say. Like
yeah.
I'm very honest. I'm like, yeah, I have sexual dysfunction from meds, and then people just get awkward when you bring up sexual dysfunction.
Right,
and it's like, okay, at least I don't get manic and go to the hospital. So I guess, see, in that instance, medicine can help, right?
Sure.
But I'm not on 10 medicines.
Right.
Like, you know, some of these patients, they're on 6 meds. We have no studies of polypharmacy, which the studies would be hard to conduct anyways. But I mean, I see patients that are on 6 meds. We don't even know which one's helping.
Yeah, that's insane.
Yeah, it's like,
it really is, man.
Yeah. I don't enjoy workouts too. I used to be a pretty athletic, strong, lean guy.
Yeah.
My metabolism's destroyed. I don't understand.
Yeah.
And then I just don't enjoy workouts. Like, I don't have that, you know, that rush you used to get, man, before you took finasteride, where it was like high.
Yep.
Obviously you push hard and you feel good and you feel more like a man, right?
Yep.
I don't feel that anymore.
Yeah, I can relate to that entirely. I mean, I still work out regularly. I've gotten a little bit of my ability to feel the rush of working out again. Nowhere close to what it was before, but before I got PFS, man, I mean, I would go to the gym. Like, I would have a long day at work, 10 to 12 hour day, exhausted, tired, hit the gym and feel super energized upon walking out of the gym. You know, it really had helped me. I felt more grounded. And now I just walk out kind of just feeling more tired. It doesn't really energize me in the way that it used to. I don't enjoy the process of working out. It's like just going through the motions. It's like brushing my teeth every day. It's like you don't want to do it. You just do it. It's part of your hygiene. Hygiene is part of your health. But you don't get the same rush from it as you used to. That's for me, that was a big loss right there. It sucks. I don't know how else to put it.
Yeah, it's that's a big loss, man, for guys that enjoy to work out or women that enjoy to work out.
Yeah.
I still do it 3-4 times a week. I sauna. I get 9 hours of sleep a night.
Yeah.
Man, I meditate. I do everything, man. I have EOE. Do you know what that is?
No, I'm not familiar.
So it's just really depressing because you get condition after condition after condition. EOE is eosinophilic esophagitis. So basically my esophagus swells from eosinophil response.
Okay.
Most of it's probably from gluten, dairy. They don't fully understand it either. Basically the food gets stuck in your esophagus.
Okay.
1, you can die. 2, it's extremely painful.
Yeah.
But I cut out gluten, dairy. I eat like a carnivore and fast kind of diet.
Right.
It helps. Like, I lost 15 pounds.
Yeah.
Because one of the psych meds, I couldn't lose weight. That was a big problem.
I gotcha.
Yeah, like no matter what I did, man. I mean, I would eat nothing but steak and I couldn't lose weight.
That's insane. That's wild, man.
Yeah, because it just messes up your metabolism.
Did you have that before you got PSSD, or was that a result of it?
The trouble to lose weight?
No, I'm sorry. The esophagus issue where the food gets stuck in there.
It was after. I got diagnosed like a year and a half ago.
Recently, okay.
Yeah, so my health is just, who knows, man. I mean, like, it's just like, it's really sad, man. I'm 36 and it's depressing just getting these incurable disorders or diseases. It's shitty.
That's the scary thing, man. I mean, I've had so many systemic effects from taking finasteride. I mean, I developed, 30 different issues over the course of just several months after I quit. And it feels like at some point or at some times that I almost continue to develop issues. Like I don't feel normal. My body doesn't function the way that it used to. I have GI problems too. There's just so many things that have happened over the course of the past 4 years. And it almost seems like my life before PFS is almost like a dream. It's like I can't even remember how I used to be or what it felt like to be healthy, because every day is just a struggle. It's just, I'm pushing through. I'm kind of surviving in some sense, even though people tell me, you look at me, I look, objectively healthy. I still work out. I take care of myself. My wife sees me eating healthy food all the time, working out 4 or 5 days a week. And even then, my body just doesn't have the same capabilities as it once did before I got all this. It's frightening, man. It really is. Because I'm 31 years old and I'm dealing with things that people in their 50s, 60s don't even deal with,
And usually like your 50s, 60s, right? You have a big old fat belly. You're
right. Yeah.
And it's like, hey man, like what'd you think your body was going to do?
Right.
Like I'm 6'1", I weigh 195.
Yeah.
I don't smoke cigarettes. I don't really even drink anymore. I don't do drugs. I do all this stuff. And again, I'm on medicines that 50-year-old fat guys on.
That's insane, isn't it?
It's embarrassing, like you said. All these doctors never even heard of PSSD or PFSD or post-Accutane syndrome. Right. They have no idea what this stuff even is. Yeah. So I again educate them. I give them a folder and I go, here's PubMed. Isn't this what you pray at the altar of PubMed? There you go.
Yeah.
So yeah, it's the only ones that are really open are like naturopaths are cool, but even them, man, they get down the supplement train. Yeah. And I've tried so many supplements, man. Like, geez, it's just like, it's exhausting, right? You just get exhausted having 15 pills. You're trying every supplement in the world, and it doesn't help.
Right. Yeah. I mean, you're so desperate for any relief. You're willing to try anything, even if it does seem kind of irrational. I mean, like you, man, I've probably spent within the first 2 years of getting PFS, I probably spent $10,000 to $15,000 on medical bills, just going to doctors, man. And that includes also like buying supplements, trying these really, I don't want to say extreme diets, but going like ketogenic, right? Buying, special foods, gluten-free, and nothing has given me any relief. The only thing that's given me relief is kind of time, to be honest with you. That's been the biggest factor for me. But even then, it's been minimal relief. I've seen some for me, finasteride essentially feminized me, made my skin very soft. My jawline receded. My face started to change, develop lipoatrophy. And I've seen some improvements in that to a certain extent. I can get a pump in the gym better than I could, 3 or 4 years ago, right? Like my muscles have somewhat come back online, but it's been so slow that you almost don't even notice it sometimes, So it's hard to tell how much my body is rebalancing versus how much I've actually maybe I've just gotten used to it. At the same time, it's really tough. I wish I could just feel normal again.
Yeah, it's depressing, man. Like you said, there's a lot of suicides from these conditions.
Yeah, there are.
So how do you track those? Right? If you're a 35-year-old man and you can't get an erection, you can't have sex, you can't have a relationship. So then you're lonely. Then you can't have a family. And obviously you're depressed, man. There's a lot of patients that just have a shitty life. Mm-hmm. And I can't fix that you're poor and, you just lost your job and you're abused by your husband or whatever, like, you know what I mean? And we just give you a pill to numb you. And maybe that helps you so you can go to therapy and whatever. Maybe helps you from crisis, but you know what I mean? Like us, like a doctor, I'm just grateful a doctor will at least be open-minded and be like, yeah, it makes sense. They can cause problems.
Yeah.
Most just like get quiet and just said, well, this is all we can offer. And I've done, like I said, I've done so many different treatments, man. I could list like 2 pages of stuff.
Yeah.
I'm at a point where I'm just where I'm at.
Yeah.
And I keep trying here and there.
Like,
just, I'd love to, if they did like a clinical trial or something, it would be interesting, but they have to recognize it.
Yeah. That's step number 1.
Yeah. And then, like I said, if it becomes recognizable, I don't think pharmaceutical companies are going to be keen on that, because I think that opens them up for lawsuits.
Yeah, absolutely.
Right? Because it's very serious, right? Like when surgery, you cut off the wrong leg, that's $1 million lawsuit, right? Multi-million-dollar lawsuit. Yeah. If you take a man's, sexual function away, I would think that's similar, right? Not a full amputation. Same with the female. Like you take away your full sexual function, dude, they're gonna be sued out the wazoo.
Yeah.
So there's I don't know. Maybe that's what changes it is a big lawsuit. I don't know. That's
like you said, they're not really incentivized to do their own research to figure out that, these medications are detrimental to some people, because then at that point they're assigning the blame to themselves. So why would they want to do that?
Yeah. I think that's why they wouldn't want to recognize it. I'm really upset too about these companies like, what is it? Roe, he, hims, all those that are just
keeps.
A questionnaire, man. A questionnaire, and they put you on Lexapro or put you on finasteride.
Yeah, isn't that crazy?
That's nuts.
Did you see my Wall Street Journal article that came out back in March on this?
I may have.
I was in the Wall Street Journal about this because Hims, they essentially prescribe the medication so easily. It's a quick questionnaire you go through, you click acknowledge, and then they essentially sell you the medication. You get it delivered to your doorstep in a matter of like 7 to 10 days. For me, it took less than 5 minutes to get a prescription for this stuff. All I had to do was take a few pictures of my scalp. And even now, I guess they've removed that step from my understanding. You no longer have to take pictures of your scalp. You just have to say, I'm dealing with hair loss, click the checkbox, submit, and then you're done. And they send you the medication. If I had known that there was even 1/10 of the side effects I'm now dealing with, let alone they're permanent, I never would have taken the medication, man. But I wasn't given true informed consent.
Your situation, man. Like, fortunately, I'm never probably going to go both, right?
Yeah.
But like, if I was balding, man, there's no way in hell. I've heard of post-finasteride syndrome for years. There's no way in hell I would trade off. Maybe it helps for hair loss.
Right.
My penis doesn't work.
Yeah. No, you're right, man. And honestly, that's the least of my concerns. If I had known about the body changes, the cognitive dysfunction, slurred speech, it's like, hey, man, that's not worth it. For me, my body, I've been bodybuilding for 15 years now. My muscles were far more important than my hair ever was. And now I'm losing both essentially. And that's horrendous, man.
I laugh because it's crazy.
No, it's all good.
Like,
it is crazy.
I know guys obsess over their hair, and I try to be optimistic and open-minded, but I'm like, dude, just shave your head. Like, if LeBron James can't fix his hairline and he spends $1 million a year on his body, what makes you think you can?
You're right. Yeah.
If you think about it, right? I'm just saying, like, it's still somehow we can't really solve it. There's stem cells in the hairline and stuff, maybe.
I think eventually it'll be solved. Yeah, I think eventually it'll be solved. And I get it too, man. This is where I try to, I take on this nuanced approach. I try to, keep a good balance between the two. Like, hair loss sucks. I understand that. But man, post-finasteride syndrome is a whole nother hell in itself. You can't even compare the two, to be honest with you. When your entire health is compromised.
The hair loss is so minimal. I will ever prescribe finasteride.
Yeah, no, good for you,
like,
man.
sertraline or an antipsychotic, maybe that does save your life, man.
Sure.
But geez, a finasteride, we're giving it just because you're losing your hair.
Yeah, for a cosmetic
and I'm like,
issue.
Does anyone kill themselves over losing their hair? I hope not.
Yeah. I know it leads to depression, but come on, man. Again, you can overcome that. You can come to a point of acceptance with it.
Yeah.
My own personal opinion, again, I would give anything, even including my hair, to get back to where I was prior to taking finasteride. Hair loss to me is so minimal at this point, man. It's not the end of the world.
Yeah, that's what I'm saying. That's what makes me even more like there's not much benefit with finasteride. I'm like, okay, but if you're like self-harming, you have the lethal means to kill yourself, and you have these active suicidality, and you might kill yourself.
Sure,
you have to try something, man.
Sure,
because the other outcome's death.
Yeah.
You know, at least in psychiatry, like there's kind of more benefit for some of these meds. The finasteride, like I said, to me is such a low benefit. This is just aesthetic appearance, which again can be important.
Right.
But now we have, you know, I don't know why exactly, but we have a ton of guys that are bald.
Yeah.
You know, like that's fairly common. So
it is.
I'll never prescribe it.
Yeah, no, good for you, man.
Yeah.
It's tough too, because I know people have different opinions about even the psych medications, where, you know, you do have people. I've talked to a lot of people who are, you know, say they're actively suicidal, or they were actively suicidal, who got prescribed like an SSRI, and now they're in such bad pain from the SSRI, they almost wish they could go back to feeling suicidal. I'm not sure if you've had that experience. That's just some of the things I've heard from other people.
Yeah. So like I said, if you're at the point of self-harm, harming others, destroying your life, and really there's a high potential for suicide, I mean, you can have an inverse reaction with the SSRIs, SNRIs, the antidepressants, antipsychotics, where you have increased suicidality.
Right.
But if you're already there and we don't do anything, you know what I mean? It's hard.
It's a very difficult balance, man. It really
but
is.
if you again just lost your job and you're sad, you know, that doesn't need to be given a med. Maybe we need to work on goals and CBT and DBT and in different forms of therapy together, and wait a little bit with the med. Or maybe we choose a medicine that's less likely to cause sexual dysfunction.
Yeah, that's
like a bupropion or mirtazapine. I'm not saying it can't happen. They're just less likely. You know, second generation antipsychotics, the Abilify groups are a little bit better for sexual dysfunction. Right. So I'm just saying, at least we can say, hey, let's think about this. And if you're really worried about sexual dysfunction, which I agree is important, then let's go with the medicine that's a little less likely. Let's think about it. Right. Like Paxil. Paxil is, I'll probably never prescribe Paxil. It has a short half-life, paroxetine, horrible withdrawal. I just probably won't choose that as an SSRI. I'm not saying the other ones are so much better. I'm just saying, like, at least critically think a little bit. You know?
Yeah, true informed consent is really the biggest factor here. You know, letting people know that this could potentially happen. And like I said, I think if a lot of people knew that there was a chance of them developing permanent, any type of side effect, not just sexual, but physical issues, neurological issues, I think a lot of people probably
we're not even going through other side effects. I'm just focusing on the sexual. But there's a ton. Emotional blunting. I mean, you take away.
That's a hell in itself, man.
Yeah, the ability to experience life.
Right.
You know, part of being human is having the range of emotion. Like, it's like I get a little sad sometimes, but I miss like feeling sad. I miss like, like crying isn't a bad thing. I haven't cried in, I don't know, in a long time. I don't even think it's possible.
Trust me, man. I get it. I almost wish I could cry at this point just to have a release, you know. I'm so blunted. I don't feel much of anything at this point. It's horrible. Yeah.
So I hope this helps, man. I'll try to advocate and push out. Like I said, as being clinicians, you know, we have to be careful because we have these boards that oversee us, right?
Right.
And anybody can turn us in for a complaint, and then we have to like defend ourselves and all this stuff. And it's like, what? Like, that's what I'm saying. You're going to see a lot less people go into medicine.
Yeah.
And, it's just not worth it. I mean, you have guys creating, creating products. You have engineers creating things and making way more than doctors without the debt and without the liability, without the stress. Like, why would you do this job?
Yeah, no, it makes sense, man. I appreciate your nuanced approach. So, Francis, before we hop off, do you have any closing statements you'd like to tell the audience?
Yeah, there's nuance to this, but there needs to be strong advocacy and there needs to be recognition. So, we got to start, that doctor, how do you say his name? Joseph what?
Whit During.
Yeah, so he's wonderful, right? Because I think he worked for FDA Pharma, and now he's independent as a taper clinic.
Correct.
I almost applied for his clinic, but it was before I passed my boards. I love his rationale and how he thinks.
He's
but
great.
You need to have more open discussions, and it's okay to admit that, hey, we have patients that are suffering, and let's figure out how we can fix it, or at least come up with some interventions. Because right now we have basically no idea.
Right.
Have you read the mechanisms of action that doctors are? There's so many hypotheses to just PSSD.
Mm-hmm.
There's like 10.
Yeah.
Dude, we're in the beginning stages, man. We
Yeah.
we don't know uh anything. We don't know if it's gut dysbiosis. We don't know if it's epigenetic changes. We don't know if it's like serotonin receptor sensitivity
Yeah.
over time. Like we have no idea, man. So
Yeah.
we're at the very beginning where we got to get this out publicly.
You
Yeah.
know,
And thank you for what you do. I appreciate you.
no, I appreciate it, Francis. Thanks so much for coming on, man.